So in 2022, NHS England invited Starlight to jointly chair a new task force on children's play in healthcare. And that task force met over a year from June 2022 to June 2023, with very focused activity from about October of 22 through to the NAPS conference, as it was then in June 2023, where we presented this report of the work of the task force, which you can find on our website. And what the task force has done is it's developed new proposed guidance to healthcare commissioners and NHS trusts, and standards, and a new QI tool to evaluate services against those standards for health play services. And NHS England are planning to publish these documents. We hope this year, we believe this year. They're very committed to doing it. They're very busy, of course, but we are hoping that these documents will see the light of day very soon. And the third work stream of the task force was to look into the issues of workforce development and accreditation. And the decision was taken by the task force that there needed to be a new strategy in place, but that needed the engagement with a wider group of stakeholders than were involved in the task force, and would also need longer to really dive into the issues. And that's what this work is about, that Irene and I are talking to you about now. So the task force agreed certain principles about what such a workforce development strategy should be. And these were to grow and develop the health play workforce to the level required, to achieve recognised, sustainable, equitable professional status for the health play workforce, to resource the health play specialist profession with the right skills and qualifications to support the new guidance and standards, and to future-proof the health play profession through career pathways, training and mentoring. And as I said, the workforce development group, there was a workforce development group that was convened to build on the work of the task force. And that group was established in December 2023, chaired by Irene. Could everybody please put their mics on mute? Thank you very much. So yeah, the Workforce Development Group was convened with a bit of funding from NHS England, so they are still very committed to this work. They commissioned us to convene the group. It was chaired by Irene, and we, with a bit of help from NHS England, were able to also engage Skills for Health, the former Sector Skills Council for the health professions, to help us to develop this work and to produce this strategy. And the strategy was launched at the SoHPS conference on the 21st of June. And this is what it looks like. And you can find a copy of it on our website. And we will put a link to that in the chat during the course of this webinar. Over to Irene.
Thanks, Adrian, and good afternoon, everybody. And so this proverb really resonated with me, being involved in this work, because I think it's really important to sort of illustrate that NAPS and HPS, as they were formerly before we've recently merged as the Society of Health Play Specialists, came to fruition in 1975, so much longer than I've been involved in this work, and many of us on the call. And actually they were a group of volunteers. Even today, the only paid roles in our organisations are a part-time administrator role and a registrar for our registration purposes. And so actually the power of collaboration with like-minded people, such as brilliant partners from Starlight, but having the funding resource from NHS England to be able to progress this work, has meant that we have been able to make such amount of progress in a relatively short space of time. And we've done that together because we've had really true collaboration. And I wanted to also illustrate that this funding for the role that I've been doing as a special advisor to the task force for the last 18 months is the first time ever that funding has been given to a health play specialist profession to do work in this space on behalf of the profession. And let that sink in for a few moments, because that is not the same as all our other colleagues that are medical, nursing and allied health professionals. They have those roles as standard, and they are standardly funded by the NHS. So I think it's really important and significant to acknowledge that this is brilliant progress and amazing progress, and look what we've been able to achieve with having that resource and infrastructure, but we need that to continue if we want this work to be successful. Next slide please, Adrian. And it really has been a true collaboration. So we have had lots of different people that oh sorry Adrian, it went past that slide. Lots of different people from different organisations, different stakeholders that all have a really key role in the profession. So that might be from education settings, running our current training courses, practitioners. We've made sure that we've included the 4 nations, so all areas of the UK. This is currently funded from NHS England, but actually we're a UK charity as SoHPS, as our Starlight. So we've really collaborated with all of the people that are doing this brilliant work throughout the UK. Next slide, please, Adrian. And alongside having that professional input and really valuable experience, none of this would stand up without having the views and experiences of lived experience from children and young people. They're what gives us our purpose to want to make sure that they have the best possible experience, which is the title of our workforce strategy. And this is a picture of a young man called Mackenzie, who was working with the Children and Young People's Transformation Board for NHS England, and they're roles that you can apply for. And he applied specifically because he had a real interest in play. He had really expressed the benefits of how play specialists and play workers had helped him during his time in hospital, which was frequent. But he also wanted to raise the issues of when he didn't have that support and what that felt like. And I think there's really important to hold a space for both sharing the good experiences, but also hearing when it's not so good and the impact that has, because that's what drives us to make those improvements and get equitable services such as play available 7 days a week. So thank you to Mackenzie for his input on this project. And I think, I've been a play specialist now for about 25 years, and I, completely see it as a practitioner in the difference that it makes for children and young people. I hear about it from my team and my colleagues. I see examples of children having MRIs awake, whereas maybe 10 years ago, there was lots of children under 10 still having to have GA or sedation. And there's loads of benefits around the cost implications, the efficiency, but I think really importantly, building resilience in children and young people to help them cope and manage, particularly when they have long-term health conditions, is really, really important. And that's something that play specialists and play professionals do so brilliantly. Next slide, please, Adrian. Back to you.
Thanks, Irene. So government guidance from the Department of Health is really clear that play services should be routinely available to children in all hospital departments, that therapeutic play helps them to cope with procedures and interventions, can reduce the need for general anaesthetic. And the recommendation is that all children staying in hospital have daily access to a play specialist. Play techniques should be encouraged also across the whole of the multidisciplinary team caring for children, including in A&E. And that guidance was published in 2003 and is still cited by the Care Quality Commission when they inspect children's services. More recently, the NICE guideline, NICE being the National Institute for Health and Care Excellence, the government appointed independent advisory body to the NHS on good practice in all areas of healthcare. This is from 2021, and it pretty much confirms what the earlier Department of Health guidance says, looking at the broadly the 2 different areas of the health play team, which is that normalizing role of reducing boredom and anxiety, helping children to alleviate the sense of isolation and strangeness by giving them everyday play opportunities, easily accessible, age-appropriate play and recreation should be available to all children, according to NICE. And it also drills down into the very specific role, that's the clinical support role of health play specialists, qualified health play specialists, in helping to reduce the fear and anxiety around procedures and using therapeutic play and distraction to create that calm environment and to mitigate children's trauma. Essentially, it doesn't say trauma, but we know that's what is really happening here. It's mitigating the risk of trauma to children from their procedures. So that's from 2021. But the actual picture on the ground suggests very clearly that in spite of this quite long-standing guidance now that's been reaffirmed by NICE, there are many children who are not getting the benefit. So these are just some of the stats from our Freedom of Information survey of NHS Trust, and we had 86% response rate. So this data is highly reliable based on that survey sample. And the current state of play, excuse the pun, is that we have fewer than 1,200 staff, only 651 registered health play specialists. 50% of health play specialists are only working part-time. Only 15% of NHS trusts have any kind of play service guidance or policy in place. There are many unregistered. We don't know the numbers, but we know there are unregistered practitioners because it is not a regulated profession. And so trusts can do that, and some of them do. Many play services are only open 5 days a week with no cover at weekends. 72% of healthcare settings have no designated budget for play resources. And by our calculation, based on the ratio that will be in the new guidance that's coming out soon, which is a ballpark, an aggregate ratio, because it will vary depending on acuity and the type of setting, but the overall ratio of 1 to 10 is the rule of thumb that we've gone with, and NHS England has agreed with that. There should be around 3,000 new, that's additional, full-time health play staff just to provide that level of cover in acute inpatient settings. That doesn't take account of any other setting or the 24/7 cover that would be needed in A&E. So we need a strategy to grow the workforce to meet that level of demand, and that's what this work is all about. So I'm going to hand back to Irene to talk about the process of building the strategy.
Thanks, Adrian. So as Adrian mentioned at the beginning, we really brilliantly managed to collaborate with Skills for Health because they are the experts in building workforce development strategies, particularly in the health sector. So we really valued their expertise to help us do this piece of work. And I think they really helped facilitate a lot of the conversations that we had as part of this group to kind of build upon what we really needed from this. What were the issues, and what were the things that we really wanted to listen to the practitioners about and address, and helped us produce a first draft of the strategy, which for anyone that's seen it, I think the response that I've had so far is people are saying it's such a really lovely visual, it's really bright, it's really engaging, it's really user friendly, it draws people in, and I think we're really grateful to the support from Skills for Health from helping us put that together. And this quote that they gave us actually as part of the feedback that they were gathering was, medicine and surgery saves lives, but health play saves children. And we all know that. I think I'm probably in a virtual room of people that, are all sort of singing from the same hymn sheet, but it's really powerful stuff. And this is coming from children themselves. And I think that's why it's really important that they are at the heart of this workforce development strategy. Next slide, please, Adrian. And so as part of the process, we met for 3 months for 2 hours with the stakeholder group. And this is just an illustration of the the whiteboard sort of interactive live chat that could be used to sort of answer some of the questions and share ideas. I think the record has been set for the probably maybe not the Guinness World of Records, but the fastest time and the most comments that have ever been shared in a group that they have worked with before. I think about 17 minutes, and there was all of these comments. So a really engaging group of people that have been involved in the workforce development group, and really great to sort of use all of that to shape the strategy that we have now. Next slide, please, Adrian. I think that's back to you.
Okay, thanks, Irene. So we decided collectively as a group that we would like to lead in the strategy document with a really clear message to babies, children and young people. And that message is this, that this strategy is for you. We want more staff when you need them. We want there to be more health play specialists and play workers to support you 7 days a week. We want better skills. We want all health play staff to have the right training, skills and qualifications to do the best job for you that they can. We want higher standards. We want health play staff to have what they need to be able to provide you with the high quality professional services that you deserve. And we want greater recognition. We want the importance of play and the staff who support you to play to be better recognised by other health professionals, by the NHS and by the public. And then we've said that we want to work with you, children, young people, your families and your health professionals to develop and implement this plan to provide the health play services you need and deserve. So that's our message to babies, children and young people, and what sets out a clear intention for what this work is all about. But those four columns, those four paragraphs, if you like, they are also the structure of the strategy, which I'll come to in a minute. And the vision is that we imagine a future where no child suffers avoidable distress or trauma from their healthcare. Our vision is for all babies, children, young people in healthcare, whether hospital, hospice or community, to be fully supported by adequately resourced health play services 7 days a week. These services should be delivered by sufficient numbers of skilled staff working to recognise standards and supported by a strong, accountable professional body. And these are the four pillars replicating the four promises to children. And this is the way we will be building this strategy. We're looking at capacity. We want 1,000 new health play staff over 3 years. You will have noted on the data slide from the FOI request that the real shortfall, at least even in only acute care, is 3,000. But we know that that's not realistic given the current levels and the capacity of the training and education sector. So we've decided that a realistic ask is 1,000 new health play staff over 3 years. And if that were repeated over each successive 3-year period, that we are suggesting to the government should become embedded within the NHS long-term workforce development plan, which is a 10-year plan and which was launched last year. So it has 9 years left to run. And so we're suggesting this should be part of that overall NHS workforce plan. We want the government to publish the new guidance, or the NHS rather, to publish the new guidance ASAP. We want a review of commissioning specifications so that play services are embedded in the commissioning process. That literally means funding, because that's where the contracts are issued. Growth in professional infrastructure. We want some support for this sector. I already mentioned the huge amount of work. We're all standing on giants here from the huge voluntary effort that this sector has put in over decades to construct what we have, which is a professional body, a recognised emerging new profession with its own occupational standards, codes of practice, professional register. All of that work has been done by volunteers, and it's time there was some investment in infrastructure to support that work going forward. Capability, so it's about developing an accessible training and qualifications framework with apprenticeship schemes, capability frameworks and continuous professional development that everybody can access who needs to maintain that continuous improvement and maintain their registration requirements. We want professionalization, that's building on that ask in the first column, which is about capacity. And this is by no means, by the way, to suggest that what has happened and what is happening right now within the profession isn't professional. It's simply saying it needs support, it needs infrastructure to develop and refine the professional register, to make that transition to become independently accredited by the Professional Standards Authority, which is one of the aims of SoHPS, and those conversations are already beginning, but that is costly and takes time. And so we want support for that from the institutions of the NHS. I'm just going to pause for a moment and say one of the principles here of this work is that seems to sometimes be an assumption within the NHS that professions are responsible for themselves. And of course, to a degree, that's true in terms of occupational standards and the training and qualifications frameworks. It's right and proper that those areas are in the hands of the profession itself. That's why we have royal colleges and so on. But the profession cannot create jobs for itself, and it cannot invest in the professional infrastructure that's needed to be able to grow and develop the workforce that the NHS needs. So this is the NHS's workforce. It's not SoHPS workforce, and it's not Starlight's workforce. This is the workforce that the NHS owes to the children, babies, children, and young people and their families who need these services. So that's the principle here, is we want this profession to be properly supported, properly integrated as a recognised, established part of the NHS workforce. And that needs, of course, proper job evaluation and banding guidelines and support for professional members by a bit of investment in the infrastructure. And finally, of course, recognition of, and that means, recognition also implies understanding. And so we want awareness raising within the NHS, as well as the wider health sector and the public, on the importance of play and the important role that play staff have with children. And we will, collectively as a field, do whatever we can to continually develop the research and evidence base to demonstrate the efficacy of play services in children's health and health care, providing information and advocacy for children and their families. We want this profession to see families as an ally, and we know they do. Health play staff are very engaged with families. We know that, and we want the government and the NHS institutions to recognise that and to support us as a sector to support families to be advocates for their own children's play in healthcare. And policy and practice development. So we are working at Starlight now with NHS England and aiming to build links with the Department of Health to see what they can do to support this work going forward. And of course, collaboration and allyship with the multidisciplinary teams, and especially with doctors and nurses working with children, but also many others, radiologists, occupational therapists, children's clinical psychology teams. There are so many staff working in the NHS for whom this work should be a real asset to what they're doing, and not enough of them know about it because the sector has been tended to be marginalised, and we want to change that. Am I handing over to you, or is this still me, Irene? Is it still me? So the proposals we're making to government are that we want the government to commit to creating 1,000 new health play jobs over 3 years. We want NHS England to publish the new guidance and standards for health play services that the task force has produced and are ready to go. We want the NHS to review the commissioning specifications so that health play services are properly integrated within the commissioning process and therefore included within the NHS contracts for paediatric services. We want more infrastructure and support for the health play profession, as I've said a couple of times. And we want there to be a review in the longer term. This profession has long aspired to be an allied health profession under statutory regulation. Government policy at this point in time does not make that easy. It makes it almost impossible. So that door was kind of closed on the profession. Hence the application to the Professional Standards Authority being seen as a next best option. But what the PSA have told us and have told SoHPS is that becoming accredited by them does not preclude future assumption into the Allied Health Professional Council as a statutory regulated profession. So if government policy changes, and guess what, there's a new government, so who knows, then we would like health play specialists to be included in that review of statutory regulated health professions. And is this you now, Irene? I think, yes.
Yeah, back to me. Thanks, Adrian. So sort of following on with the proposals and recommendations, we want to really think about career pathways and training qualifications. We have listened, deeply to practitioners and sort of training providers, and we know there's a geography sort of postcode lottery as to how you can access training. For currently, there's none in Scotland, for example. And so we're really trying to work collectively to get solutions to that. So a couple of examples to sort of just highlight, I think, are the model that's currently running with Leeds City University, where for London areas, they can deliver the most of the training virtually once a week to the apprenticeships, and then will come down and do, I think, every four to 5 weeks a session in person. It's just making the training more accessible for people to be able to do that. So that's one example. Another example is, we have lots of people that are graduates that have done a similar degree, maybe something like play work, with our colleagues at Leeds Beckett University, but then they don't want to go back and do a foundation degree for 2 years because they've already got a first degree, but they really want to become a registered play specialist. So it's a chicken and egg. So we're really working with Leeds Beckett University to see, can we map out a route to registration for those people who have a relative degree but actually need to get registration and need to get those practice hours, and that conversation's really progressing. So I just wanted to illustrate those two examples of how we're really proactively trying to address the ask of 1,000 new health play professionals in 3 years. How are we going to achieve it if we don't change how you can access the training or the profession? And we're equally open to other people's suggestions as well. I suppose the other thing on this slide I really wanted to sort of re-emphasize Adrian's points is that, for us to not be a mandatory accredited profession, really is a huge risk when you think about how close we work with babies, children, young people. Any other profession that's working that closely are registered and mandatory registered. And I think that that's the thing that we're waiting for. If an opportunity arises with a change in government policy, this is a safeguarding risk, which is something that gets more attention than maybe some of the other things that, we want to sort of raise around this. And I just wanted to really emphasize that, because I think it's something that as a profession, most people are in agreement that we do want to be a mandatory registered profession. Next slide, please, Adrian. And I suppose the other thing Adrian touched on as well is really connecting with our multidisciplinary team. So a couple of examples to highlight and share are that we're working really closely with the RCPCH, the Royal College of Paediatrics and Child Health. We have 2 representatives that have been part of the task force. So we're really collaborating with them to think about how can we get in earlier with junior doctors and medical students to talk to them about play, to help them understand why play is so important to babies, children and young people, and the role of health play specialists and play workers. We're also working closely with the RCN, and we've had representatives from the RCN sitting on the task force the whole way through as well, but equally want to reach out to our colleagues in the wider AHP. So we've had the Royal Society of Radiographers have also had a representative on the task force. So it really is wide collaboration, because we need those allies to support the work we're doing. And actually there is a lot of wins in it for them. We know that working with our colleagues makes their ability to do the job they need to do often quicker, smoother, and causing less trauma to those babies, children, young people. So we're going to continue to strengthen those relationships. Next slide, please, Adrian. And this is another sort of example of a kind of, you said we did. So when we first started this task force, Adrian discovered that health play specialists and play workers were sitting under, what's the category we're under again, Adrian?
Corporate services.
That's the one. Sorry about that. Corporate services, which had other professions like chaplaincy, so it and sort of admin sort of roles, and it really felt like they didn't know where to put us. So we reached out to NHS Careers, and actually we were right. They didn't know where to put us. They didn't know what they didn't know. So they put us in that category because they weren't quite sure what we did and where we sat. And so having a really good engagement with the team there, we managed to quite quickly move health play staff to clinical support staff, because we know we can't sit under allied health professionals yet because we don't have that accredited mandatory registration. But actually, this is a much better place and a much better fit for us to be. And the next slide will show you that the blurb about what a health play specialist wasn't terrible, but it felt a little bit undervalued and a bit of a nice to have. It was around sort of bringing fun to children in hospital, which is, don't get me wrong, a really important part of our role, but there's a little bit more to it than that. And actually having that conversation, educating them to understand what we do. This is now what is on the NHS Careers website to describe health play staff, and this is where we got the title for our workforce development, the best possible experience. So it just shows you that with collaboration and helping people understand, we can make positive changes. Next slide, please, Adrian. And so the next steps are that if you haven't already had a look at the workforce development strategy, please do. It's on the Starlight website. Sarah can possibly stick it in the chat if she hasn't already. We've got a consultation out until the 31st of July. We really want to hear from people. The other thing I'd really encourage all of our colleagues that work in the NHS is please disseminate this and share it far and wide. So an example of that is we have a distribution list at my trust where about 1,000 people, you can send out those comms emails that everyone kind of needs to know that works in babies, children, young people services. So ask if you can do that. Share the link. There's a QR code. Ask people to look at it. Get people talking about it. Get it on people's radars. We really want this to be something that is adding value and talked about and is fit for purpose when we take all the feedback over the summer months and then publish, hopefully in the autumn, alongside the other documents, the full version of the strategy. And I think I'm handing over to you now, Adrian, for the last slide.
Thank you. Thank you very much, Irene. So, yeah, I mean, you will have gathered from what we've been saying that a lot of what we're asking for is going to need a move in this direction towards us from the government, not just NHS England, because ultimately we're talking about resources and policy commitments. So we need to make our case to politicians. So when the election was announced, as it was only 6-7 weeks ago, we quickly moved to produce a manifesto for children's play, which you will find on our website. Manifesto for children's play in healthcare, I should say, which we call Playing with Children's Health. You can't really read that, so I'll tell you what it says in terms of the actual policy asks. We're asking for health play services available 7 days a week, supported by an initial 1,000 new health play professionals. And we can say, by the way, we've got a workforce development strategy now to demonstrate how the sector can meet that challenge. We want the new guidance and standards for health play services that the task force has already produced to be published. So if any government minister wants a quick win, there's one that we've made earlier. And we want training in play for all children's health professions. We feel this is so important that just the fundamentals of, the Bob Claber at the RCPCH conference last year in Glasgow led with a keynote speech called Leading with Kindness in Children's Healthcare. And it was a wonderful presentation. Didn't mention play, which seems a kind of almost obvious thing to include in that context of being more person-centered, more patient-centered, kinder, gentler as a profession, as a pediatric profession. So we believe that training for all pediatricians, children's nurses, and everybody else working in the multidisciplinary teams around children could so benefit, and therefore benefit their children, by having some basic training in play and also in the role of the health play staff, so that they really understand your role and take all those appropriate steps to fully integrate them in the planning and the care of the children and young people in those settings. And that is what we're asking for in the next one, which is play to be integrated in the commissioning and design. If play isn't part of the if play services aren't part of the commissioning process and included within those mandatory NHS contracts, then it's always going to be hard to make your business case, because where's the funding coming from? So it needs to be integral. It's not a service that will get commissioned on its own, because the way that NHS contracts are commissioned is through clinical services, and this is not a clinical service. It's a clinical support service for all services that are working with children, babies, children, and young people. But it needs to be within all of them that are for children and young people, so that the service can be constructed from the composite of each of those contracts. And then the business case for growing the service should be a no-brainer, because the money should already be there in the contracts. And to lead all of this, we are asking the government, which is kind of already pledged to do in its election campaign, to produce a long-term plan for children's health. Well, we want that long-term plan for children's health to be led by a cabinet minister for children, rather than just education. And we're aligning ourselves there with the RCPCH, who have also called for this, and incidentally also the Liberal Democrats, who we didn't know were calling for this at the time that we were deciding that this is what we wanted to put in our manifesto. But having a cabinet minister for children, not just education, a lot of people in the children's sector believe that is a prerequisite for getting a more balanced approach, and for having children's needs in the health sector given the same priority as children's needs are in the education sector. And we're asking everybody to sign the play pledge. We've got nearly 800 people signed up already. We would like that to treble. I'm pulling that completely out of the sky, but we just would like more. So please go on our website and disseminate the play pledge far and wide, especially if you're in touch with any MPs. Please ask them to sign up to this pledge. The campaign doesn't end because we've got a new government. In fact, it becomes even more important because we have a new government, and there may be great opportunities to really develop some ideas that they are interested in. And finally, we just wanted to pay tribute to Sophie's legacy of being an absolutely invaluable ally to all of this work, right from the very start on the task force. And indeed, it was Sophie, 9-year-old girl, sadly died of cancer. But before she died, she left, if you don't know this charity, it's an amazing charity. She left a bucket list for her mum of the things that she wanted her mum to carry on campaigning for after she died. And one of them was that health play services should be available 7 days a week. And she said, you wouldn't run a ward without a nurse. I don't think you should run a ward without a play specialist. And it was that hearts and minds powerful story that many of you will have heard her mum Charlotte tell in many different contexts at the SoHPS conference and other places. She's a real powerful advocate, and it's just a reminder to all of us why we do this work and why it's important that we keep up this fight. Working together step by step, we will get there. So thank you very much, and thank you, Irene. And we've now got about 15 minutes for questions, answers, hopefully, and comments or discussion. Over to you. And I'll have a quick look at the chat while people decide if they want to put their hand up or not, and see if we've got any in here to respond to. Oh, wow. There's quite a lot in there already. So somebody doesn't have their camera on, that's okay. Can't see the slides. Oh dear.
Adrian, I would just go down to Eugene's comment because a lot of
Okay.
it was sort of me fielding tech stuff.
Okay, I do apologise if any of you didn't see or hear properly. Don't know what to do about that. Sometimes the tech doesn't quite work. England would like to work with Starlight to ensure alignment with the work we are shaping via our manifesto, strategy and development on workforce, particularly on professional standards. Eugene, lovely to hear from you. Thank you very much. Well, we should meet, shouldn't we? Would you like to say anything in this space now that we have this time, Eugene, or should we just get in touch?
I can do if you like. Yes.
Hi, Eugene. Please go ahead.
Yeah, I've put the link in the chat so people can have a look at the manifesto. There's a whole section on workforce. A lot of it is around professional standards across the piece. It does briefly mention the work that Starlight are doing around play in hospitals and the vital role that it plays, and obviously you guys are specialists in that. But where we can get alignment on that would be great, particularly around professional standards, workforce registration. I think there's some real value in that as well. And again, just keep up the fantastic work, and any support we can lend to you and others would be greatly sort of welcomed.
Fantastic. Thanks very much, Eugene. Let's be in touch, and maybe we can look at how the Workforce Development Group, which will be meeting again once the consultation is finished, to take on board all of the responses, how we can align it with the wider play workforce development field. Absolutely. Thanks very much, Eugene. Really appreciate that. Somebody's just come back from the RCN Congress in Wales, Jane McCready. And one of the resolutions that was voted for was registration of allied health professionals. Is that right? Would you like to say anything about that, Jane? If you're still here.
Yeah. So a resolution.
Thank you.
So 4,000, can you hear me? So 4,000 nurses attend RCN Congress, and I think I've been going for the last 12 years. And it was voted because the members actually vote for it. And so what happens now is it now goes to council. So council do that work, and then it goes, like, if need be, to government. So obviously the time's come, I think, really, for allied health professionals to be registered. And, you know, that hopefully would include us, wouldn't it? But I will tell you this, that I am not registered because I can't be registered and belong to the RCN. So you have to weigh the difference up. So there's actually, I need to get on to the RCN about that. You know, there's a big part of it. So yeah, that's why I'm not registered, because I couldn't belong to the RCN and I'm a rep.
Thank you, Jane. Thank you very much for sharing that.
The other thing I can say is also, you know, the RCN have a children and young forum, children and young persons forum. So maybe one of us could get onto that forum, and then we can be the voice of the children regarding play, because that's what children do. So there's a thought.
Thank you so much, Jane. RCN were on the task force of the executive group of the task force, but it's true, I think, to say that we haven't been closely engaged with them through the development of this strategy. They haven't been on the workforce development group, and I think it's really helpful that you've raised that important potential allyship with RCN. I think Irene and I will definitely be taking that forward, and maybe we could drop you a line and have a longer conversation, if that's all right, Jane, because that sounds like...
What I can do, because obviously I'm on the forum, is post some of the folks, some of your slides on that forum, if that's okay, because that's what our aim is. Because, you know, every ward should have a PlayStation. Shouldn't they? Every ward. Every should have some sort of understanding. So that's what I can do. And the other thing I can do is also go. The trust have regular chit chats with the executive team. So, and I go to staff side. So there again, that's another way I can bring this up to make them aware to fly that flag.
Fantastic. Thank you so much. Thank you.
Camera's back on again.
I'm just looking to see if there are any other comments in the chat, or if anybody has their hand up. Somebody does have their hand up. I can't see who it is because there's 67 people. Oh, it's Tina Holton. Tina, please ask your question.
Yeah, there's two of us here, myself and my colleague Karen. We just wanted to say thank you very much for the presentation. The work that the workforce has been doing is extremely positive. We think the most positive work we've seen in all the years we've been in play. Hopefully it doesn't look like we've been in it that long, but we have. Because there really does seem to be some future proofing of it. We were commenting during it about the part of it being embedded in the commissioning, which we thought was really forward thinking, because the way services are commissioned out now, we had a urgent care centre that was commissioned out for a while, not for long, but that had no provision in there because it wasn't in the commissioning standards for it. So we thought that that was, it really showed future proofing as well. And the other part was the development and qualifications and registration. We thought that was really clearly described by you, Irene, because that's a big worry for us, is that the expectation would therefore be put on to be able to provide that service. But if we can't actually provide the qualified staff, and there definitely was some really hopeful messages in there. We did have one question. If the workforce happen to know how many play specialists get qualified every year at the moment nationally at all, is that something that the workforce knows? We saw other statistics, but we were just curious.
Irene, you might be able to answer this. What's the current rate of annual new registrations?
Good question. I don't have the number off the top of my head. I know that the current register has about, is it 680 currently registered health play specialists, and I think coming, I don't know if any of my colleagues from education are on the call, but I mean, sort of doing the maths roughly in my head, you probably have somewhere between 60 and 80 potentially qualifying after the 2 years. So I think that's kind of roughly where we're at. But yeah, if we're going to be bold and ambitious, which we are, you know, you have to be bold and ambitious to get anything done, and then work backwards potentially, or, you know, change your path and still kind of have that aims. Then I think that we need to, yeah, think laterally as well as horizontally about how we get there. Definitely. But thanks for your comments.
Thank you.
Thanks, Irene. There's a question, or rather there's a hand up. Savitri, I hope I pronounced that correctly, Fernandez.
Yeah, thanks. I work in an A&E, so I work in a 24-hour A&E as a play worker there. Been there 25 years, so yeah. The question is about the hospital play specialist course. What a lot of people that I work with, they have other jobs as well as working in the hospital as play staff, is that it's not available. If it was available online, a lot of people will find it much easier to access at the moment, because there's only certain places that can do it, and it's a 2-year thing. It's a lot of people are feeling a bit awkward to actually participate in the course. So that's one of the things that we're having setbacks with, trying to access the hospital play specialist course to actually be a qualified hospital play specialist.
Yeah, thank you for that comment. I don't know if you want to respond to that, Irene, or if there are any training providers on the call who might like to respond to it. There is a comment in the chat about the cost as well.
There is, yeah, and I think, yeah, it's I hear what you're saying, and we've heard lots of people having similar challenges. I think it's not just even accessing it from geography point of view, it's the cost. You know, there's a cost of living crisis and everything else in between. So we completely understand the challenges that people have got. So I think sort of one route to some of this, it's not the only solution, is the apprenticeship route. I think that, you know, the government levy, that money is there within trusts already, so there's no cost to send staff on the apprenticeship training, and it's something that we've been really working with collaborators and providers on. I think it's a really good model, and I think you know, with this workforce strategy, the idea to grow your own, because there are lots of practitioners of as the person that just raised this, already working within play and health with babies, children, young people. So why don't we upskill the staff that we've got, if they want to do the training but they can't because of accessing it or the cost, you've got the opportunity to do that with the workforce strategy, setting out the ambitions and actually having courses that are more accessible through the apprenticeship route. But I definitely think there's room to make more courses accessible through delivering training partly online and thinking creatively about that.
Thanks very much, Irene. Amanda Williamson, you have your hand up.
Hi, yes, thanks for the presentation today. It's fantastic. What we would like to know is how close are we getting to get the course back in Scotland? Because the apprenticeship isn't available here. So the cost obviously is great and the travelling that's involved. So how far away are we from getting it back?
Not sure if we can answer that.
Yeah, the short answer is I don't know, but I think to reassure you that one of our Scottish representative is Margaret McEwen. I'm not sure what hospital you're from, but if she's the lead of the service at Edinburgh Children's Hospital, and you're right, it's different governments, devolved nations. So we have, some influence, but we can't sort of drive that without the government policy from those areas. But I think what we'd hope in the work that we're doing within the task force, it's transferable to wherever. So I know there's colleagues on the call from Wales as well. This is, and there's different legislation in Wales. So I think it's about not having to reinvent the wheel. So when you do have those opportunities, you can use the workforce development strategy. You can use the standards and guidance that we've already done. Which happens a lot in health boards, apparently in other health sectors and professions. But yeah, I'm sorry I can't give you a sort of confirmed answer, but we're here to support you and to work with you when the opportunity comes.
And what I would add to that, thanks Irene, and what I would add to that, Amanda, you might want to come back as well, but just to add to what Irene has said, this strategy and the other work that we're doing with NHS England, new guidance and new standards, and the advocacy that we're now really engaged in with the Department of Health and the rest of the government to recognise the importance of this area of children's health services is designed to grow the capacity of the workforce. That's why the top level of both our manifesto and the strategy is about the creation of new jobs. Everything else is going to be just simply stretching in different directions to try and deliver a service to children and families with too few resources and too few people. So that's where we start from. If those jobs are created, it's a market. Training and education is a marketplace. And if those jobs are created and the demand there is therefore there within the sector for those skills and qualifications to be available, courses will emerge because training providers will respond to that new level of demand, that new investment, and the courses will emerge because that's how markets work. So watch this space. We can't ourselves, we're not training providers and neither is SoHPS. We are aiming to stimulate the market by asking the government and the NHS to create new jobs, and then the training and education sector will respond as it always does.
Well, let's keep hoping. I really do hope it comes back because it is. There definitely is a need. Absolutely a need. But thank you very much for it.
No, thank you. And as Irene said, although this work at the moment is because health is a devolved power and the health service is run by different institutions in each of the 4 nations, we're quite a small team at Starlight. It's just Sarah and I are the whole of the policy and public affairs team. I mean, we're supported by lots of other colleagues as well. But as far as that focus is concerned, it is a small team. We simply cannot do it in parallel in 4 different countries, working with 4 different governments and 4 different institutions. But we are a UK-wide charity. And as soon as we either have the capacity or we've done as much as we can here to feel like we can begin to put our focus elsewhere, and we've already begun to do some of this in Wales, and we fully intend to do it in Scotland and Northern Ireland. When we've got the capacity, we will be reaching out to all of you, working up there and in Wales and in Northern Ireland to make the same kind of engagement with the NHS institutions in those other 3 nations, and also with the devolved governments and their responsibility for health and children's health. And I think that probably brings us to the end of the webinar, unless anybody has one final comment or question. We've got 2 minutes. Just check the chat quickly, make sure I haven't missed anything important. 100% agree. That's nice. Oh yeah, about the need in Scotland. Yeah, we do hear that. Okay. Well, look, thank you so much, everybody, for joining us.
There's just
Sarah,
a hand
did I miss anything?
Sorry, there's just a hand from Josie. Oh, is that just
Yeah, sorry.
again?
No, go ahead, Josie.
I wanted to go and ask about sharing the QR codes with obviously staff and like obviously parents, families.
Yeah.
Is this something we can just do in our department?
Please, yeah, because there is an opportunity for people to say who they are, like not name, but like whether they're a profession or what profession, or whether they're a family. So yes, please share it as far and wide as you feel inclined.
If I just create a QR code leaflet and just explain briefly what it's about. Yeah.
Take a photo of the document and that QR code. Yeah, that's the one. Or share the link that Sarah's put in the chat.
Yeah, thank you.
Brilliant. Thank you so much, everybody. It's been a great webinar as far as I'm concerned. Just hearing the response and lots of really good conversation and engagement. Do please share the document far and wide. Do please have a look at the survey through that QR code and tell us what you think. These are proposals. We can't do this without a response from the government and the NHS, because we can't create jobs with all the will in the world. We can only do the best job we can. We can't create new jobs. That's going to need a commitment from the health service. So this is a campaign as much as it's a strategy. It's a set of proposals. So tell us what you think of them, share them far and wide. At some future point, when the consultation is finished and when we have hopefully had some kind of response from the government and from the NHS, we will publish a fuller document that puts all of these ideas into a roadmap over the next 3, 4, 5, maybe 10 years, setting out a real future-proofed long-term strategy to grow this workforce to deliver the services that we all know children and families need. So thank you all very much, and hopefully we'll see you on the next webinar. Thank you.
Thank you.
Thank you, Irene. Thank you so much.
Thanks everyone. Have a good rest of your day.
Thank you.
Oh, that was nice.